Good afternoon. When I spoke to you all last week, I explained that the number of COVID patients going into hospital had doubled in a fortnight, and I explained that the rate of infections was climbing steeply. I said that we face the sad reality that on these figures we could expect many more daily deaths. And so that's why we announced a package of restrictions and stronger enforcement last week. At the same time, we've been intensifying the local lockdowns in areas where the disease has been flaring up. And I want to say I know how tough it is and has been for these communities. And I want to pay a particular tribute to the students who are experiencing a first term back at university unlike anything they could have imagined. I can assure you and assure everybody at universities that plans are being put in place to allow students home safely for Christmas. And I wish I could tell you tonight that the impact of this package has already begun to appear, but it will take time to feed through. And yesterday we saw the biggest rise in daily cases since the pandemic began. Today, a further 7,108. We've also had a tragic increase in the number of daily deaths, with 71 yesterday and again today. And these figures show why our plan is so essential. We have to stick to it together, and we should stick to it with confidence, because there are many ways in which we're far better prepared than we were in March. We're on track to hit our target of being able to conduct 500,000 tests a day by the end of October. We're already exceeding the number of tests per capita that are conducted in Germany, France and Spain. We have over 2,000 beds that could be available across seven Nightingale hospitals, and we will be able to go further if needed. We've ordered 32 billion items of PPE, and we'll have a 4-month stockpile of masks, visors, gowns and other essentials for winter. By December, by the way, we expect UK manufacturers will meet 70% of the demand for PPE, compared with just 1% before the pandemic. And in the last 6 months, we've more than trebled the availability of mechanical ventilators to our NHS across the UK to 31,500. But the best way forwards to protect the NHS, save lives, to keep our children in school and the economy moving, is to follow the rules wherever we live. So I want to thank everyone for the fantastic national effort that we are seeing and continuing to see. And no matter how impatient we may be, how fed up we may become, there is only one way of doing this, and that's by showing a collective forbearance, common sense, and willingness to make sacrifices for the safety of others. At this critical moment, when I know people will be wanting to know the details, I will be providing regular updates through these press conferences. And I have to be clear that if the evidence requires it, we will not hesitate to take further measures that would, I'm afraid, be more costly than the ones we put into effect now. But if we put in the work together now, then we give ourselves the best possible chance of avoiding that outcome and avoiding further measures. I know that some people will think we should give up and let the virus take its course, despite the huge loss of life that would potentially entail. I have to say, I profoundly disagree. And I don't think it's what the British people want. I don't think they want to throw in the sponge. They want to fight and defeat this virus. And that is what we're going to do. Even as we fight COVID, it's vital that people get all the treatment they need for other conditions. But it must be clear, if the NHS were to be overwhelmed by COVID, then no one could get any such care. And that's why we must bear down on this virus now, so that we never reach that point. And I'm absolutely confident that with ever increased testing, with better treatments, and of course with the prospect of a vaccine, we will get through this. So Let's follow the rules, wash our hands, cover our faces, observe social distancing, download the app, as 14 million of you have already done, and together we will fight back against this virus, protect our NHS, and save many more lives. I'm now going to hand over to Chris Whitty.
Thank you, Prime Minister. First slide, please. I thought it was sensible to start off looking back over what happened in the first wave of this pandemic in the UK. And these are the Office for National Statistics data, the ONS data, showing all-cause mortality, which is the most important thing to look at, because it includes both the direct deaths from COVID in the red line, but also the indirect deaths, which are the excess deaths over the yearly average from all causes, because as we know, and it's been discussed many times in these meetings, you can have people who die because the health service is overwhelmed, or because the health service is less able to operate effectively, or in the long run, because of the economic impacts of the interventions we have. So all-cause mortality is critical. And if you look at this across the various areas of England, and the same is true, in fact, if you look in the other three nations of the United Kingdom, what you see is a wave that happened over the period from late March through to July in all-cause and COVID-associated mortality. And these data are broken down by region. Next slide, please. The pattern we are seeing in the current upswing in COVID cases is at this point in time, and this may change, rather different. There is, on the left, what we have is the total rate in terms of the amount of COVID that is being detected on a weekly basis, where darker colours are the more severe, the higher rates. And as you can see, at this point in time, there is a very heavy concentration in particular areas, in particular in the northwest, the northeast, and parts of the Midlands. But on the right, what you can see is also the increase in COVID activity that is happening over the last 7 days. Any colour in orange means it is increasing, and the darker the colour, the more rapid the increase. So what you can see in this is that there's a general increase across the whole of England, and the same is also true in Scotland, Wales and Northern Ireland, with a few exceptions, but a very rapid increase in particular areas, again, particularly in the northeast, northwest, and areas of the Midlands, not exclusively there. Next slide, please. And this breaks this down into the regions of England, but also looking at different age groups. And what you can see in each of these areas is the multiple age bands from the dark blue, which are the youngest children, up to the black, which is those aged 80 or over. And in most regions of England, you're seeing a relatively flat, though gradually rising picture in terms of number of COVID cases over time. But if you look at the northeast and northwest and Yorkshire and Humber, and to a lesser extent the West Midlands, you can see a significant rise now, particularly in younger people, but increasingly also in people who are older and have a greater risk of having a bad outcome. Remembering, of course, that young people can also have bad outcomes in terms of prolonged symptoms, even if they do not have a fatal case or one that gets some intensive care. So this increase, as you can see, is accelerating quite rapidly in some of those areas. Next slide, please. Some people are worried that this might be based just on testing capacity, so this is a different way of looking at the same thing in the same areas, looking at test positivity rate. And in parts, in particular, of the northeast and the northwest, we've moved from a situation where, by age group, the average might have less than 5% of tests being positive, up to a situation where, for some age groups, over 15% of tests are now positive. This implies there is a very significant increase in terms of transmission in these areas. Again, quite variable across the country. Next slide, please. It's important to differentiate between different age bands, between younger people, children and young adults. And this is just to make the point, in the dark blue and light blue colours, we have children 5 to 10 and 11 to 14, and in green we have children aged 15 to 16. And in these groups, currently, the rates are actually really not changing very much. These are school-age children in the main. Whereas in older young children and young adults, in those 17 up to 21, and the same is true for other young adults, the rates are now going quite rapidly. I've chosen to illustrate it with slide positivity. I could have done this with other routes. So this is important to remember when people worry about schooling. Schools are one of the areas, school-age children is one of the areas where the rates are not going up. And this is true across the country. Next slide, please. There is, I think some people are wondering whether we could actually have a situation where the rates of infections are going up, but we're not seeing increases in hospitalization. So what this has on this slide is the admission rates on the right to hospital and the intensive care rates on the left by age. And I think an important thing to see on this is that the dark blue, dark line at the top and the green line, which is the one below that, in terms of people being hospitalized, are those 85 and over and 75 to 84. So older people are getting this, and they are then having to go into hospital and then transferring some of them, sadly, into intensive care. Next slide, please. And if we look at the hospitalizations across the country, they follow very much the pattern you would expect from the rates of infection. So in the northwest and the northeast and Yorkshire, the NHS data show that the rates of hospitalisation are now climbing steadily. They're at a much lower level than they were at the beginning of April. I want to stress that really clearly, but they are definitely heading upward at a now relatively steady and rapid pace. In other areas, this is rather slower, and London and the Midlands are between these areas. Next slide, please. Final slide is just to look again at the intensive care rates, and people who enter intensive care are at significantly increased risk of dying. And this is again just showing in the northeast and in the northwest in particular, but also in London to some extent, we're seeing a significant uptick in the number of people who are entering intensive care. This is not yet at a stage where it is threatening our ability to have intensive care cases. There's still significant capacity in the NHS system, but this is definitely heading the wrong way. The final point I'd like to make before we go on to just an animation looking at the spread over time is about those who do not have COVID, and it is something which my colleagues in the medical profession have asked me to stress really strongly to people this evening. And that is that the NHS is absolutely open for business, and it is absolutely there, not just for emergencies, for cancer care and for all other kinds of care. So what we're not saying is please don't go to hospital, please don't go to your GP, absolutely not. We definitely are very, very keen as a profession, as well as within government, that that continues. But we are just pointing out that the direction of travel for both hospitals and intensive care is clearly going in the wrong direction, particularly in these areas which have seen rapid increases in cases. We now have an animation. So this shows a map over time, starting in March. Lighter colours are small amounts of COVID. This is how it spread in the first wave. And on the right, you can see the wave getting steadily darker, concentrating at that stage in particular around London, but also other areas of the Midlands, North and elsewhere. And then due to the remarkable efforts of the entire nation, everybody coming together, we got on top of that wave. People kept social distancing, they kept to all the rules about hands, face and space, and we had significant things that led to people not coming together in households. And the amount of COVID went down over time, but then it started to come back again, concentrating initially in a small number of places, but then has steadily spread. initially in these areas in the North and Midlands, primarily, not exclusively, but now potentially spreading elsewhere if we do not all take all the various issues about social distancing and hands, face and space very seriously. Thank you very much.
Thanks very much, Chris. And I think that point about the NHS and the capacity of the NHS and the openness of the NHS to people to go and have their issues dealt with is very, very important. But obviously that becomes much less possible if we get an increased spike in the disease across the country. Let's go to questions from the public first. To Tia from Oldham.
That the appropriate support is available across the UK for young people to be able to fulfil their potential moving through these times of uncertainty, as lockdown and COVID-19 have affected young people's mental health, education and youth unemployment has risen.
Well, thank you very much, Tia. I think the answer to that is obviously that we will do everything we can to help young people through this difficult time, and you'll have seen the package that we put in place to support people going back to universities, working with the Vice Chancellors to get COVID-secure universities. And again, I thank students for the responsible way that they are behaving. In terms of employment for young people, Tia, the answer is that we really want to help young people get into jobs wherever we possibly can. That's why we've launched the Kickstart plan, £2 billion Kickstart plan to give people support in jobs, give employers support from the government up to the value of the living wage to support young people into work. And I'd also mention what we're doing in terms of training, the lifetime skills guarantee that we announced yesterday to give young people in their 20s, the ability to retrain, get the jobs that are out there. And we will do everything we can, as I've said repeatedly, to put our arms around the workforce, help young people through this pandemic and bounce back as strongly as we can the other side. Thanks very much, Tia. Let's go to Carl from Milton Keynes. Carl. Forgive me, Carl, I'm going to read your question. With areas in the country now under more stringent local lockdown rules, how are the enforcement agencies going to stop those people in these areas travelling to other parts of the country that have fewer restrictions? Well, clearly there are local areas, Carl, that are under particular restrictions, and what you should do is look at the website if you're in one of those local lockdown areas and see what restrictions you need to place, what guidance you specifically need to obey. But what we're not doing at the moment, Carl, is going back to the situation we were in March, and I really don't want to do this. I don't want to go back to a national lockdown where the overall guidance is stay at home. That is not what we're saying. We want to keep the economy moving. We want to keep young people, pupils in education. But the only way we can do that is if we all follow the guidance and depress the virus, get the virus down by following that guidance and keep things moving as much as we possibly can. Carl, thank you. Let's go to Laura Koonsberg of the BBC. Laura.
Thank you, Prime Minister. We can see today that the limits are already in place on millions of people have not stopped the spread, and you even had to apologise for failing to explain the rules properly. How can people have confidence in your government's approach? And can you give people your honest assessment? How high is the chance of more restrictions coming in for everyone, everywhere? And if I could ask Professor Whitty and Sir Patrick, you spelt out a possible terrible trajectory last week with as many as 50,000 cases a day. Now, the way you did that caused some controversy. With 7 days of extra data, what do you say now about how bad this might get?
Well, Laura, the answer is, I'm afraid, entirely dependent on how effective we are now collectively in driving down the virus. And we know we can do it because we did it before, and we did it in March and April, and by collectively working to stop the transmission of the virus from one person to the next, from household to household, as we did in March and April, we greatly reduced the number of of deaths. We massively reduced transmission. What we have now is a package of measures that we brought forward last week, and it's a combination of national measures, the increased enforcement of the rule of six, the restrictions on hours of hospitality, the measures, the intensified measures on wearing face masks, plus the basic hands, face, space, national measures, and then with tougher enforcement, and then local lockdown measures as well. And what we hope is that if people obey the guidance, fulfill the guidance in the way that they can and in the way they have in the past, then we'll get the spread down again. That's what we're working towards. And the strategy is to do that whilst keeping the economy open, the vast bulk of the economy open, and keeping young people in education. Those have got to be absolutely crucial priorities for our society. So I'm confident that we can do it together if we follow the guidance, but our success will have to be judged, I'm afraid, in the days and weeks ahead as we look at the numbers that come in. And as I said in my statement earlier on, it is still too early to tell whether that budget, that package of measures, is being successful. And its success depends on all of us working together to follow the guidance. Chris and Patrick, sorry.
Thanks, Laura. There were three messages, really, that we were trying to get across in terms of the data. The first was, if you look at other countries, you see that cases go up, followed by spread to older people, followed by hospitalizations, and unfortunately leading to ICU and to deaths. That looks like what's happening here. The second message was that cases were already increasing at the time that we gave that presentation, and you could already begin to see increases in hospitalizations, which, as Chris has shown, have increased further since. The illustration was to point out that epidemics either double or halve, they're either growing or shrinking, and doubling means that things go very big quite quickly. So things move quickly. And when things double, you see that exponential growth, which means you end up with very high numbers, and it means you've got to act quickly in order to deal with that. And as Chris has laid out today, we're seeing quite fast growth in some areas of the country. It's not uniform right the way across the country, but there's clearly fast growth in some areas, and those numbers are going up. And unfortunately, as we've seen, not only cases going up, but we're already seeing an increase in deaths. So things are definitely headed in the wrong direction. I do want to just make one comment, though, which is quite important to understand when looking at the numbers of cases. The number of cases that we're seeing now are picked up because there's much more testing. The number of cases that are reported in March were almost certainly a very big underestimate of the total. So it's much more likely that back in March and April, at the peak of this, we were seeing over 100,000 cases a day at certain times. Whereas, of course, you were only able to measure and report a fraction of that. So it's not a direct like-for-like comparison.
Thanks very much, Laura. Can we go to Robert Peston of ITV? Thank you.
Hello. If you go back to the beginning of August and you track infections in England and Scotland, they have risen massively faster in Scotland. And again, within England, there is a much bigger problem in the northeast and the northwest in terms of rapid rise and incidence of the virus. Can you explain why there is this very big difference between the northern part of the country and the rest of the country? And then secondly, 71 deaths. On March the 21st, there were 71 deaths. Today and yesterday, there have been 71 deaths. Back in March, we were 2 days away from full lockdown. You don't think things are as bad or as urgent in terms of more remedial measures as you did then. What is the difference?
I'm going to ask Chris and Patrick to comment both on the epidemiology, the localization of the disease, and the difference in the rate of spread of the disease between now and March the 21st. But clearly, one point I would make as somebody trying to get this disease down across the whole country is I do think that it is possible that there is a difference, Robert, now in the way the disease is expressing itself in the country. We are seeing some very clear local peaks, just as I think and Chris has made this point to me and publicly, just as there were local peaks in Italy and other countries, and it may be, and it's too early to say, but it may be that again this is a more localized phenomenon this time, in which case all the more reason for us to concentrate on these local solutions as well as the national solutions. But I think on the point about the rate of climb of the disease between now and March, I think it's a very interesting point.
Shall I have a first go? Yes. Patrick will probably want to add to this. I mean, if you look around Europe during the first wave that happened here, the UK was actually an outlier in having an epidemic that was almost uniform in shape, although not absolutely in size, across the whole country. And if you look at Italy and Spain, for example, significant epidemics, but very, very highly concentrated. Now, it is possible that in this next stage of the epidemic here, we will have a pattern more like that, where it is more highly concentrated in certain areas, lower rates in the others. But it is far too early to say that. We've got a long winter ahead of us, and a lot could happen over that time. So I think to predict forward from here would be a big mistake. But it is certainly possible that if we all work together, if everybody follows the guidance, then we could actually contain it within the areas where it is in the way that happened to some degree, as I say, in Italy and Spain. In terms of where we are compared to where we were in March, you're absolutely right in terms of your numbers, and Patrick and I have had the privilege of being attacked both for being too pessimistic and too optimistic on the numbers. The reality is that the doubling time at the moment is slower than it was in March, when it was 3 to 4 days, and that was one big difference. And in fact, one of the problems we had in the first wave was I think we initially underestimated how fast the doubling was occurring at that stage, and it's very important we don't do that a second time, because once exponential growth starts, as Patrick has said, things go very quickly. Also, we are going up from a base, the sort of the tail of the first wave in terms of deaths is still occurring, and then these new ones are on top. So it's not a straight like-for-like comparison. But you are completely right that this small number of deaths now shouldn't reassure us that we won't be in relatively short order in quite difficult places, certainly in the regions where we're seeing significant growth at the moment, where pressure on the NHS could happen sooner rather than later if we can't get on top of it really quite fast.
Yes, numbers of cases are going up, hospitalizations are going up, ICUs going up, and unfortunately, very sadly, so are deaths. And that means that this is headed in the wrong direction. There's no cause for complacency here at all. And sticking to the social distancing rules, I mean, this virus spreads because of close contact in certain environments. So we all need to make sure we reduce the number of contacts we've got. We need to reduce contacts in certain environments, particularly indoor spaces, poorly ventilated. And we need to make sure we reduce the probability of coming into contact with somebody who is infected by all of us making sure that if we have symptoms or we're contact, we isolate and keep out of circulation. It's going to be absolutely critical.
Thanks very much both, and thank you, Robert. Beth Rigby, Sky News.
Thank you. Prime Minister, at the last press conference when you announced the rule of 6, your parting words to us all were socialising gatherings of no more than 6, inside or out. That's the way I think we can beat the current outbreak. But 3 weeks later, the numbers are clearly going in the wrong direction. You just said that you are prepared to introduce national measures if the evidence requires it. Have you 3 agreed a threshold at which you will have to introduce national measures? And to Professor Whitty, the COVID surveillance survey shows the virus is overwhelmingly spread within households or with people visiting other households. And yet on this measure, different nations have gone in different directions. Is that because different chief medical officers have offered different scientific advice, or is that down to different political decision making? And are you personally mixing with other households at the moment?
Right, Beth, just on your first question, I think the best thing I can say is we keep all of this under constant review, and as you can imagine, ministers and officials are really meeting more or less round the clock the whole time, watching what's going on. The JBC, Department of Health, PHE, we're watching round the clock what is happening in all the areas where we have cause for concern. And as I said earlier on, we will keep all measures under review. We really don't want to go back into the kind of stay-at-home national lockdown that we saw in March and April. That's not what we want to do. We think that we can beat it by other means. We think we can beat it together by the means that we've described. But we've got to watch what's happening, and we will.
On the question specifically to me, the reality is that in different countries, we're all broadly using the same groups of things that we're doing. I think people always highlight the differences. In fact, the similarities between people's responses are considerably more striking than that. But there are inevitably variations, and a lot of them are to do with what is the local traditions about how things are actually operated, how people socialise in different spaces, which do vary. They genuinely vary between different countries. And then some of it will be to do with what seems to work in a local environment. We're all, however, trying to pick our very difficult way between doing not enough and therefore not getting on top of this virus, and doing too much where we do get on top of the virus but do unnecessary harm socially and economically. And it is, the economic impact of that on health in the long run would be substantial. So trying to find a way through, and it is slightly different in different countries, and in some cases a bit more than slightly different. But I think that the differences are always highlighted, and the similarities, I think, are actually much more striking. In terms of do I follow the guidance and the rules, I try absolutely to follow whatever the local guidance is locally. And I also, I have changed my behaviour, as I suspect everybody watching this has changed their behaviour since this epidemic began. And if the rules tighten up, I will try and follow the new rules. That is completely what we all should be doing, because that is the only way we collectively are going to get on top of this.
Thanks very much, Chris. And thank you, Beth. Can we go to Pippa Crerar of the Daily Mirror?
Hello. Given everything that we've seen and heard over the last couple of weeks, I wonder whether Professor Whitty and Sir Patrick, you have any concerns that the government may not be going far enough, fast enough to get the R8 under control. And Prime Minister, if you look in shops and on public transport, it's quite clear that there's still loads of people that are not wearing masks or following the guidance. What would your message be to them?
Well, just first, Pippa, let me just say what I've said to everybody. Please follow the guidance, and bear in mind that you're doing it not just to protect your neighbour, but ultimately somebody that you transmit the disease to could end up infecting someone that you love. It is absolutely crucial that we stop the spread of this disease. Wear a mask on transport in the way that is recommended, and bear in mind that the fines are now very considerable, and they will be imposed.
Well, in terms of your first question, it's very clear that rates are still going up, and so we don't have this under control at the moment, and the increases that Chris has described in some areas are of concern, and as I've said, will lead to further problems. So it's incredibly important that the adherence to the principles of trying to reduce contact in the way that I've described are critical to get this under control. And the decisions that need to be made are clearly very difficult. None of them are risk-free. They all come with some cost, and that's human cost in some form or another. Science can provide advice on the situation. Ministers need to make decisions as to when and how to act.
Thanks very much, Patrick, and thank you, Pippa. Can we go to Chris Smith of The Times?
Thank you. Can I firstly just pick up on one of the things Patrick said about the need to isolate if you've got symptoms, but a survey by the government and its scientific advisors recently showed that under 20% of people are, when they have symptoms, or contacted by test and trace. So why do we think that is, and does it not fundamentally undermine whatever national or regional restrictions are in place? And on the point about the localised nature of the outbreaks so far, I mean, are you saying now that the government strategy is to come down hard over the winter on the north of England in order to spare London, South England, elsewhere tougher restrictions?
Well, can I just have a go at the second point there, Chris? What we want to do is just stamp out or bear down on the virus in such a way as to get the R down below 1, where we need to do that most, and that's clearly in the areas that we've identified. That's why the extra restrictions that are coming on in those areas, and the faster we can get it done, the better. And it's all about compliance, all about getting on. If you have any doubt at all about what to do in those areas, get on the website and check out what the restrictions are. But working together, I've absolutely no doubt that we can do it.
Maybe I'll have a go at the first one and then Chris can come back in. I mean, I think just as a general comment, it would be wrong to take from this that this is a problem that's only in certain areas. It is worse in certain areas, but there is evidence of spread everywhere, and we need to be mindful of that, and everyone needs to take precautions across the country. Your comment about isolation, it's very, very important that isolation does occur. The point of testing is not to get a result on its own, it's to make sure that you take action, and isolation is clearly part of that. It's important for symptoms and it's important for contacts. And if we don't isolate, we will end up with more people circulating than, well, you don't want anyone circulating ideally, but you'll end up with people circulating and giving the virus to others. So the isolation is important, and you're right. The study that came out in a few weeks ago suggested low levels of self-declared intent to isolate. And that was from a few months ago. I think the figures more recently may suggest a slightly more positive picture, but it's for all of us to do. I mean, it's something that you can't literally enforce upon people. It's something that we need to do and take accountability for, because by not isolating, we're increasing the chance that others will catch it. And of course, it will spread amongst the age groups and cause the problems we've described. Chris, do you want to? Sorry.
Well, I think the only thing to add is that I think there is, when you look at polling or other data, the great majority of people are very supportive of this, and the great majority of people wish to do it. And the support for this is strong because people wish to get on top of this, because they realise this is the way they can protect their neighbours, their families, and the NHS. And that is really clear, I think, and has been remarkably consistent, and is a strong tribute, as always, to the remarkable altruism of the British people.
Yes, so just listening to this, I realise there is a slight danger of people getting the wrong message from this, in the sense that, yes, of course, and you're right to pick this up, Chris. Yes, of course, it is more acute in these particular local areas, but it is vital to stress that this remains a national threat and a national challenge, and we all have to fight it together. We can't just expect it to be solved, in the parts of the country which we, I think are particularly affected. It's down to all of us. Jonathan Walker, Newcastle Journal and Chronicle.
Hello, Prime Minister. Under the restrictions in place in the North East, a person can't legally visit their parents in the back garden, but they can legally sit with 5 mates in the pub beer garden, although they're advised not to. Can you explain the logic behind these rules, and what help is available to businesses who are struggling to understand and enforce these rules in the North East? Also, if I may, in addition, can I ask you, have you considered that just as complex national rules had to be replaced by something simpler, the rule of 6, there may be a case for doing something similar with local lockdowns?
Yeah, well, I obviously what we're trying to do here is to fight it nationally with a package of measures that I think everybody is familiar with. Hands, face, space, the rule of 6, the reduction in hospitality hours and so forth. Locally, in the North East, what we're also doing is restricting contact. You can't meet with your own household group inside, whether at home or in hospitality settings, and that's the rule. And you can't you're encouraged not to socialise outside. And of course, and people will pick up on various discrepancies or complexities that have arisen as a result of this local approach. The best thing I can tell you, Jonathan, is everybody in the North East or elsewhere, in Merseyside, Midlands, everywhere where there are local restrictions, get on the websites, look at precisely what you need to do. But so much of this is about common sense and about following the basics of the guidance, and just restricting the possibility of transmission from yourself to somebody else, or from somebody else to you. And I think people do instinctively now understand how to do that. The more we do that, the more efficiently we do that, the better the chance we all have of getting this virus down. Thank you very much, Jonathan. Thank you, everybody, and see you next time. Thank you.